The CDC advisory panel is meeting today to consider authorizing the COVID-19 booster shot for people aged 12 to 15. The meeting comes a day after the CDC declined to add a testing requirement to its isolation guidelines. Some experts called for a testing component after the agency shortened the isolation period from 10 days to 5. But at-home tests are getting harder to come by and more expensive. Retailers like Kroger and Walmart are raising the price of rapid testing kits from $14 to $24. The companies raised the prices after fulfilling their pledge to sell the kits at cost for 100 days. But President Biden announced on Tuesday a website launched this month for people to order a free at-home test. The rapid spread of the Omicron variant sparked the closure of the nation's third largest school district. Chicago schools are closed today as officials try to figure out how to proceed with classes after the teachers union voted to transition to remote learning. CBS's News' Bradley Blackburn has the latest.
The CDC is warning hospital admissions and deaths will likely increase in the coming weeks as the record-breaking COVID surge continues. New hospital admissions in Miami-Dade, Florida are up 550% in just 2 weeks.
As the hospitals get strained, there is less opportunity to provide all these resources to the one single patient.
Because of the surge, Chicago's public school teachers voted to switch to remote learning, prompting officials to cancel classes.
Going into schools puts us at risk, puts our students and families at risk.
The CDC tried to clarify its guidance for people who test positive but are asymptomatic or mildly ill. The agency stopped short of requiring those people to get a negative test before ending isolation after 5 days. But it said if someone has, quote, access to a test and wants a test, they should use it. And those who test positive should isolate for another 5 days.
It is confusing. It does feel like a bit of a choose your own adventure. If this, then this.
It all comes as the U.S. sees a shortage of rapid antigen tests nationwide.
At this pharmacy in Denver, rapid tests are selling out on the same day the shipment comes in.
We ended up selling through 600 within the business day.
The federal government is launching a website for Americans to order free tests, but it won't be up and running until later this month. Bradley Blackburn, CBS News, New York.
For more on this, I want to bring in Dr. Julie Morita. She is the Executive Vice President of the Robert Wood Johnson Foundation and a former member of the Biden administration's Transition Advisory Board. Doctor, thanks so much for taking the time to be with us.
Thanks for having me, Meg.
So yesterday, the CDC backed the FDA in authorizing boosters for immunocompromised children 5 and older. A lot of people want to know if it's safe for kids in that age group and older to get a booster. Why wait to authorize it for everyone, not just the immunocompromised?
Meg, that's a really important question because there's a difference between what was approved yesterday by CDC and what's being considered by their advisory committee today. What was approved yesterday is for a 3rd dose of vaccination for people 5 to 11 years of age who have abnormal or weakened immune systems. Because with the first 2 doses, they didn't get necessarily an adequate response to the vaccines, and so they need to get a 3rd dose just to protect them overall. What's being considered today by the advisory committee is whether or not an additional 3rd dose is needed for people who are otherwise healthy, who had normal immune responses to the first doses, and to actually authorize that to actually boost their immunity because over time, their protection has waned. So they're 2 different things. It's like comparing apples to oranges at this point. They're just different things.
So, as you know, there's a lot of debate right now over the CDC's guidelines for isolation if you have COVID. 5 days of isolation if you test positive and no requirement to take a test at the end of that period to see if you're negative. Is this safe, or are we going to see people walking around after 5 days who still have COVID?
Yeah, I think the key thing from my perspective is that the recommendation was decreased from 10 to 5 days because we know that the greatest amount of transmission from an infected person happens in those first 5 days. To then add an additional test is an extra precaution that you can take. But the recommendations also include for people that, regardless of whether in isolation or not, continue to wear masks, because we know there is still a risk of people who 5 to 10 days out might transmit the infection. So wearing a mask is still really important. important. So limiting your isolating for the first 5 days is really important when you're most likely to transmit it. Then continuing to wear a mask for 5 to 10 days afterwards is really important. And if you test and are positive, then that means you have to increase your isolation period of time. But it's the vast majority of people will no longer spread after 5 days.
So why did the CDC decide not to require the testing at the end of the 5 days? I think people want to know, is it because scientifically it's not needed, or do you think the decision was influenced by the fact that at-home tests are getting harder to come by?
Well, I think we do know that the test supplies are not adequate right now. I think the science was really driving the decision to limit the number of days from 10 to 5, and also to continue to wear masks. In terms of the test kit supply, it really is important that they ramp up the supply of this test kit so that people who want to test can actually have access to the test kits. We know that they're currently insufficient.
Dr. Morita, you're in Chicago, where the big headline today is that schools are closed because of a dispute between the school district and the teachers union. The union says it's not safe to teach in person with the rapid spread of the Omicron variant. We keep hearing, especially from top health experts, that the safest place for children to be is inside school. Do you think schools should return to remote learning?
Yeah, Meg, this is really heartbreaking for me to see. As a pediatrician, as a mom, as a public health person, I know how important it is for our children to be in school settings. And we really want them to be learning, to get the social and emotional support and stimulation that they need in a school setting. But the pandemic is truly giving us a challenge in terms of high rates of disease that are affecting many, many teachers, many, many students. And I think what we'll see throughout the nation is periodic closures of schools. The key thing from my perspective is getting those kids back into school as soon as it is possible, as soon as it's safe, as soon as we're comfortable getting these kids back in the learning environment. That's where they need to be and where they learn best.
Do you believe it's safe today to send those students back?
I think in places where they are able to stand up the type of systems that the CDC has been talking about for the past 2 years, adequate ventilation, social distancing, mask wearing, encouraging vaccination. We now have vaccination available for most of our students, for the teachers and faculty as well. Getting vaccination, wearing masks, social distancing, having adequate ventilation, in those settings, we can definitely keep the schools open. But there may be periodic closures because of high rates of disease in a particular school, or because teachers or students are out. They're just because they're sick.
Well, let's hope they can resolve that as soon as possible. As you mentioned, it is safe to be in school for these students. Dr. Julie Morita, thank you so much.
Thank you.